Hey everyone, this is Arun. I'm a certified professional coder and I'm a healthcare revenue cycle expert. In this video, we are going to see how to code for pain management services. What is trigger point injection and when provider uses trigger point injection? When a patient is having a pain and not in the muscle and it's not relieved with the help of over-the-counter drugs or using the physical therapy, the provider then goes for a trigger point injection. In trigger point injection, the provider uses anesthetics or corticosteroid substance to relieve the patient from the pain. This is generally painless method for relieving patient from the pain. Common muscle groups treated with trigger point injections. Masseter, it's a muscle in your jawbone, and levator scapula, that's a muscles from your neck to your scapula, and gluteus medius, it's a muscle in your hip, and quadratus lumborum, it's a muscle in your lower back, deep in your lower back, and trapezius, that's a muscle starts from your neck and it's connecting all the way to your shoulder, and then sternocleidomastoid, it's a muscle from your mastoid bone and all the way connects to the center of your clavicle and the sternum bone, and temporalis, that's a muscles on your sides of your head. There are two procedure codes used for trigger point injection. One is 20552, another one is 20553. 20552, the description is injections, single or multiple trigger points, one or two muscle groups. Whether CPT 20553 is for injections, single or multiple trigger points, three or more muscle groups. These procedure codes are grouped in a way the number of muscles treated, not the number of injections performed. Let's see an example for each CPT code. A patient presents with a neck and shoulder pain. The provider performs 6 injections on the patient's trapezius muscle and 3 on the levator scapula muscle. The right CPT code for this scenario is CPT 20553 because I have previously stated that these are grouped based on the muscle groups. So here we have like two muscle groups. One is trapezius muscle and another one is levator scapula. So based on the muscle groups, the correct CPT code is 20552. And another example, I have a patient complains of severe lower back pain. The provider performs a single trigger point injection to the patient's quadratus lumborum and 2 injections each to the gluteus maximus and gluteus medius. Here, the provider performed injections on 3 different muscle groups. The first one is quadratus lumborum, and the next one is gluteus maximus, and the last one is gluteus medius. So based on the number of muscle groups, the right CPT code is 20553. Sacroiliac joint. You can find the sacroiliac joint between the sacrum and the ilium. So when the patient is having a pain in this area, the provider injects anesthetics or steroids into this sacroiliac joint to relieve the patient from the pain. The right CPT code for sacroiliac joint is CPT 27096. The description is injection procedure for sacroiliac joint, anesthetic or steroid with imaging guidelines like fluoroscopy or CT, which includes arthrography when performed. This is actually a unilateral code. When you build this code, make sure you add appropriate modifier like RT and LT, laterality modifier. When the provider injects injection on both the sides, you have to add 50 modifier with 1 unit of 27096. And when the provider injects injection without imaging guidance, you have to use the CPT code 20552, not 27096. Before moving to further procedure codes in pain management, let's see a little bit about anatomy of spine. The spine has 33 vertebrae with 5 regions, 7 cervical, 12 thoracic, 5 lumbar, 5 sacrum, and 4 coccyx. Epidural administration. When the provider administers anesthetic or steroid into the epidural space, that shuts down the pain that's carried over through the nerves through your brain. There are 8 procedure codes used for epidural injection. The first 4 are 62320, 62321, 62322, and 62323. The description for 62320 is for injections of diagnostic or therapeutic substances like anesthetics or steroids, not including neurolytic substances, including needle or catheter placement, interlaminar epidural or subarachnoid, cervical or thoracic without image guidance. And 62321 is for cervical or thoracic region with imaging guidance, that's fluoroscopy or CT. For CPT 62322 is for lumbar or sacral without imaging guidance, and CPT 62323 is for lumbar or sacral with imaging guidance, that's fluoroscopy or CT. Another 4 codes are 62324 is for injections including indwelling catheter placement, continuous infusion or intermittent bolus of diagnostic or therapeutic substances like anesthetic or steroids, not including neurolytic substances, interlaminar epidural or subarachnoid, cervical or thoracic without imaging guidance. For CPT 62325 is for cervical or thoracic with imaging guidance. For CPT 62326 is for lumbar or sacral without imaging guidance. For CPT 62327 is for lumbar or sacral with imaging guidance. The coding guidelines for the CPT is you have to use only 1 unit for CPTs from 62320 to 62327. And how to pick a right code for epidural injections? You have to follow these 3 instructions when picking the right code. First, you have to check the injection type, whether it's a normal injection or it's a continuous infusion or intermittent bolus. The next one is the region in which area the injection was given, whether it's cervical or thoracic or lumbar or sacral. And then the last one is imaging guidelines. You have to check whether the injection was given with or without imaging guidance. Based on these 3 criteria, you can choose the right code. This is the cheat sheet. You can use it for your practice to pick the right procedure code. When the provider injects anesthetic or steroid into transforaminal epidural space, we have 4 CPT codes: 64479, 64480, 64483, and 64484. 64479 is for cervical or thoracic single level. 64480 is an add-on code for cervical or thoracic region for each additional level. 64483 is for lumbar or sacral region for single level. 64484 is an add-on code for 64483 for lumbar or sacral region for each additional level. This all codes includes imaging guidance like fluoroscopy or CT. Facet joint. Facet joint is a joint. You can find it in the posterior side of your spinal bone. This gives the stability and flexibility to your spine. When the provider injection into the facet joint, we have 6 procedure codes: 64490, 9192, 9394, and 95. 64490 is for cervical or thoracic region for the first level. For the next second level, you have to use add-on code 64491 in addition to 64490. For the third and further levels, additional levels, you have to use 64492. This is for cervical or thoracic region. If the injection was given in lumbar or sacral region, we have to use procedure code 64493 for the first level. For the second level, you have to use the add-on code 64494. For the third and additional level, the right code is 64494. This all codes includes imaging guidance, fluoroscopy, and CT. Nerve block works by preventing the pain signal from reaching the brain. The CPT 64400 is for injections, anesthetic agent or steroids for trigeminal nerve. There are three main branches for trigeminal nerve, that's ophthalmic, maxillary, and mandibular nerve. Then the procedure 64405 is for injections or anesthetic or steroids for greater occipital nerve. These nerves are located at the back side of your head. The procedure 64415 and 64416 is for injections, anesthetic or steroid for branchial plexus. Branchial plexus is actually responsible for connecting nerves to your shoulders, arms, and hands. For continuous infusion by catheter, you have to use 64416. For just an injection, you have to use CPT 64415. Then CPT 64417 is for injections, anesthetic agents or steroids for axillary nerve. You can see the axillary nerve on the shoulder. 64418 is for injections, anesthetic agents or steroid for suprascapular nerve. That's a nerve branch from branchial plexus that actually connected to two rotator cuff muscles, infraspinatus and supraspinatus. Infraspinatus is responsible for the external rotation of the arm, and supraspinatus is responsible for the abduction of the arm. CPT 64420 and 21 is for intercostal nerve. For the single level, use 64420. For 64421 is for each additional level for intercostal nerves. The CPT 64425 is for injections, anesthetic steroids for ilioinguinal or iliohypogastric nerves. 64430 is for injections, anesthetic agent or steroid for pudendal nerve. 64435 is for paracervical nerve. 64445 is for sciatic nerve. If the injection is given through a continuous infusion by catheter for sciatic nerve, use CPT 64446. For 64447, this is for the femoral nerve. For continuous infusion by catheter for femoral nerve, use 64448. CPT 64449 is for lumbar plexus, posterior approach, continuous infusion by catheter. CPT 64450 is for other peripheral nerve or branch. CPT 64451 is for nerves innervating the sacroiliac joint with imaging guidance. For 64454, this is for genicular nerve branches including image guidance when performed. 64455 is for plantar common digital nerves. Radiofrequency ablation. When the provider uses a heat produced by a focused radio wave to reduce the pain, that's called radiofrequency ablation. CPT 64625 is for radiofrequency ablation. Nerves innervating the sacroiliac joint with imaging guidance, that's fluoroscopy and CT. There are a few guidelines as do not report CPT 64625 in conjunction with CPT follows. For radiofrequency ablation, nerves innervating the sacroiliac joint with ultrasound use 76999. For bilateral procedure, use CPT 64625 with modifier 50. For unilateral, use appropriate laterality modifier. Thermal destruction. When the provider uses heat for the destruction of nerves to reduce the pain, that's called thermal destruction. CPT 64628 is for thermal destruction of intraosseous basivertebral nerve, including all imaging guidance for first two vertebral bodies, lumbar or sacral region. For each additional lumbar or sacral region, use add-on code 64629 in addition to 64628. Chemodenervation. When the provider uses a chemical component to destroy the nerve to control the pain, that's called chemodenervation. 64611 is for chemodenervation of parotid and submandibular salivary glands, bilateral. This code itself is a bilateral code, so there is no need for 50 modifier on this code. 64612 is for chemodenervation of muscles innervating by facial nerves, unilateral code. This is a unilateral code, so you have to use the appropriate laterality modifier with this code. For bilateral procedures, add 50 modifier along with the CPT code. CPT 64615 is for chemodenervation of muscles innervated by facial, trigeminal, cervical, spinal, and axillary nerves, bilateral. Report this code once per session and do not report this code in conjunction with the following procedures. And for guidance, see procedure 95873 and 95874, and do not report more than one guidance for CPT 64615. CPT 64616 is for chemodenervation of muscles, neck muscles, excluding the muscles of the larynx. This is a unilateral code. For bilateral procedure, report this code with 50 modifier. For unilateral code, use the appropriate laterality modifier. For chemodenervation guided by needle electromyography or muscle electrical stimulation, see the procedure 95873 and 95874. Do not report more than one guidance code for any unit of 64616. 64617 is for chemodenervation of muscle, larynx, unilateral, percutaneous, including image guidance by needle electromyography when performed. This is a unilateral code, so use appropriate laterality modifier. For bilateral code, use the 50 modifier along with this code. And do not report this code 64616 along with 95873 and 97874, because this code 64617 itself it includes needle electromyography, so there is no need of separate CPT code for 97873 and 974. For diagnostic needle electromyography of larynx, use CPT 95865. For chemodenervation of larynx performed with direct laryngoscopy, see CPT 31570 and 31571. Chemodenervation of extremities or trunk muscles. CPT 64642 is for chemodenervation of one extremity 1 to 4 muscles. For each additional extremity for 1 to 4 muscle groups, use add-on code 64643. CPT 64644 is for chemodenervation of one extremity, 5 or more muscles. For each additional extremities for 5 or more muscle groups, use add-on code 64645. CPT 64646 is for trunk muscle for 1 to 5 muscles. For 6 or more muscle groups in trunk muscle, use CPT 64647. Destruction by neurolytic agent. When the provider uses alcohol as a neurolytic agent for the destruction of nerves to control the pain, that's called destruction by neurolytic agent. CPT 64600 is for trigeminal nerve, CPT 64605 is for trigeminal nerve second and third division branches of foramen ovale. 64610 is for trigeminal nerve second and third division branches of foramen ovale and or radiologic monitoring. CPT 64624 is for genicular nerve branches including imaging guidance when performed. And do not report CPT 64624 in conjunction with 64454. 64624 requires the destruction of each of the following genicular nerve branches. The genicular nerve branches consist of superolateral, superomedial, and inframedial. If a neurolytic agent for the purpose of destruction is not applied to all of these nerve branches, that's a reduced service. So we have to use a 52 modifier to indicate that this is a reduced service along with this procedure 64624. CPT 64620 is for intercostal nerve. 64633 is for paravertebral facet joint nerve with imaging guidance. For cervical or thoracic region for single facet joint. For bilateral procedure, use this code with the 50 modifier. For unilateral, use this code with appropriate laterality modifier. 64634 is an add-on code for 64633. For each additional facet joint injections, use for bilateral procedure, report this code twice and do not report modifier 50 in conjunction with 64634 because this is an add-on code. CPT 64635 is for destruction by neurolytic agent for paravertebral facet joint nerves with imaging guidance for lumbar or sacral region for single facet joint. For bilateral procedure, report this code with the 50 modifier. For each additional facet joints, use add-on code 64635. And there are a few guidelines. Use 64636 with conjunction with 64635 because it's an add-on code. For bilateral procedure, report 64636 twice and do not add modifier 50 in conjunction with 64636 because it's an add-on code. Do not report 64633 to 636 in conjunction with 77003 to 77012. For radiofrequency ablation of nerves innervating the sacroiliac joint with imaging guidance, use 64625. Destruction by neurolytic agent for pudendal nerve, use CPT code 64630. For plantar common digital nerve, use CPT 64632 and do not report 64632 in conjunction with 64455 and 64640 is for peripheral nerve or branch. That's all. Thank you for watching this video. Hope this video helps you on pain management coding. If you need any billing or coding guide assistance, contact me through email. My email is in the description box. Have a great day. Bye-bye.